Hi, everyone. I'm Catherine Chou, Senior Director of Research and Innovation at Google. I've always cared deeply about society's well-being and believe technology done well can create positive change. I've seen this firsthand being a part of a group in Kenya called LEWA. LEWA supports community conservancy, helping people with healthcare, education, their environment, and wildlife. Here's a picture of me and an orphaned rhino in Kenya. Technology done right and in partnership with the local communities can advance causes like this. Today, I'd like to share how Google Research is using AI to make progress on some of humanity's biggest challenges. One effort that we're proud to announce is expansion of our flood forecasting initiative. Floods claim tens of thousands of lives and create billions of dollars in damages around the world every year. Their impacts are particularly severe for individuals in low-resource regions, which often lack effective early warning systems. Accurate, accessible forecasting has the potential to decrease fatalities and economic damages by 30 to 50%. Last year, we sent 115 million flood notifications to 23 million people in India and Bangladesh, directing them to flood alerts over Google Search and Maps. Initial research by the Yale Economic Growth Center, supported by Google.org, found that our notifications tripled the number of people who received flood alerts and quadrupled the number of protective actions taken. Today, I'm excited to announce the expansion of our flood alert coverage to 18 new countries, including Brazil, Colombia, Sri Lanka, and 15 African countries, including Chad, Nigeria, Republic of Congo, and South Africa. Our team is also addressing wildfires, which have been increasing in recent decades and are expected to worsen in the coming years due to climate change. Every year, wildfires cause billions of dollars in damages and produce over 7 gigatons of carbon dioxide emissions. Our machine learning models, trained using satellite imagery, allow us to identify and track wildfires in real time and predict how they will spread, enabling us to support firefighters and other first responders. Today, we're proud to announce our wildfire detection system in the US, Canada, Mexico, and other parts of Australia. Beyond disaster tracking and prediction, we are happy to announce that our technology supports post-disaster relief as well. In collaboration with the UN World Food Program, we developed a machine learning tool that analyzes satellite imagery to identify damaged buildings after disasters. This tool gives crisis responders crucial information about the most heavily hit areas in the first days of the response effort. Following Hurricane Ian, our technology evaluated over 400,000 buildings and identified 69,000 damaged buildings. This allowed the charity Give Directly to deliver $2 million to more than 2,900 low-income families living in heavily impacted areas, starting within a week of the landfall. We used the same technology to support government relief efforts during recent flooding in Pakistan. We hope to continue to empower organizations to deliver aid faster to those who need it most. In addition to tackling environmental challenges, we're also using AI to advance the frontiers of medicine and give people critical health insights, even when access to care is limited. One of our research projects aims to improve maternal survival rates in regions without ultrasound sonographers. We have partnered with Northwestern Medicine to develop AI that assists nurses and midwives to easily collect and interpret ultrasound images. Our AI tool has the ability to determine fetal position and gestational age, critical for helping healthcare workers identify issues early in pregnancy. Importantly, this technology can run on-device on low-cost devices without connectivity, making it useful in regions with limited infrastructure. We're also driving the future of health AI applications on consumer phones. One of our longest-standing efforts is diabetic retinopathy, a leading cause of preventable blindness worldwide. Working with public health agencies, we've reached more than 150,000 patients using ARDA, our Automated Retinal Disease Assessment. In the past year alone, we've doubled their screenings. We're now evolving this technology to work with a photo of an eye taken on a consumer phone. This will unlock screening for anybody who has a smartphone with a camera. Our advances in computer vision are also enabling phones to become powerful means for triaging care by detecting vital signs like heart rate and respiratory rate. These tools are now being used by hundreds of thousands of Android users, and in the past month, we've expanded our capabilities to detect sleep disruptors like coughing and snoring. This marks the first time people will have easy access to longitudinal information about their respiratory health. We still have many challenges to address if we're going to improve the overall well-being and that of our planet. I hope this helps you imagine the potential of AI creating a better future. We look forward to sharing even more advances with you next time. I will now pass it to Doug, who will talk about our work in generative AI.